Hello, everyone. I'm Dr. Donnica Moore, and I'm delighted to be the guest host of another episode of Women Talk, my favorite show. Today, we'll be discussing dry eye disease, what it is, and what you can do about it if you or a loved one may have it. In this conversation, we'll hear from two very different perspectives: a patient, Debbie Auday, and her treating optometrist, Dr. Alan Austin. Dr. Austin is in private practice in Orange County, California. He's the past clinical director at TLC Laser Vision Center and an optometrist at the UC Irvine Medical Center Department of Ophthalmology. He has over 20 years of patient care experience. He was the first eye doctor in Orange County to treat patients with dry eye with intense pulsed light, IPL, and has performed more of these treatments than any other doctor in the county. In recognition of these accomplishments, he was recently named to Newsweek's prestigious list of America's Best Eye Doctors for 2023 for the second year. Debbie Auday is a professor of graduate studies in education, a volunteer and patient advocate. She first experienced symptoms of dry eye disease in 2010, and it took seeing over 37 medical professionals to achieve more comfortable eyes. Debbie has helped many people with symptomatic eyes by sharing what she has learned about living with dry eye disease. Welcome, Dr. Austin and Debbie. We are delighted to speak with you. And to jump right in, Dr. Austin, what is dry eye disease?
Sure. Thank you for having me, Dr. Moore. Pleasure to be here. So dry eye disease is very prevalent. Recent studies indicate that about 38 million Americans suffer from it, so maybe more common than you would think. A good overall term would be ocular surface disease, because you can have dry eye patients who actually have a wet, runny eye. So ocular surface or dry eye encompasses multifactorial cause of dry eye. So there can be systemic factors, there can be factors that have been induced surgically, all sorts of things that we'll talk about later that can be the causes of dry eye. But basically, patients will present with symptoms of burning, red eyes, irritated eyes, tired eyes. There's a lot of things that can masquerade as dry eye or mimic it, but usually you'll present with burning or irritated eyes will be the first sign there.
And Debbie, what was your experience with dry eye? I know you had a long journey.
I did have a long journey, and back in 2010, there wasn't as much available as for patients today. I had occasional dryness, seasonal dryness when the heaters came on. My doctor offered to put a punctal plug in my eye, and I said, sure. He said, this will keep you from using over-the-counter drops. After a year of having that plug in my eye, there was an infection. And so an ocular plastics surgeon went in and cleaned out my tear duct and said I was good to go. And then about a week later, it had scarred over, and I had epiphora. And so I had to have more surgeries. So it was many revisions of putting a stent in my eye. And I didn't blink much during that time. So when we were done with the stents, it wasn't successful. I still had epiphora. I had the symptoms of dry eye at that point. And I had stinging and burning and a gritty sensation, like there was something in my eye. My eyes were red and tearing over. And everything was hostile to me, like fans and being out in the wind and air conditioning, a heater. It made it impossible for me to use my eyes and very painful. And that's when I started to see doctors. And my first doctor he was a dry eye specialist. That was his title in the practice that he was doing. He offered me over-the-counter drops, and he offered me and told me to use baby shampoo and warm compresses with rice in a sock. After 3 months, he said, I can't see you anymore. And that's why I just kept seeing doctors, and they would say, we can't help you. We don't know what to do. This is not our specialty, until I finally found the right doctor.
Well, I'm sorry that it took that long. And of course, it sounds like you've had a very complicated case, but the original symptom was what?
The original, yeah, just tired, gritty red eyes. What Dr. Austin was talking about, those things were pretty classic for me, but not all the time. It probably would have gotten worse if I hadn't had the punctal plug, but I was on the way to having needing more treatment than just over-the-counter drops, I think, at that time.
So, Dr. Austin, is this gritty, uncomfortable feeling generally a pretty good tip-off that somebody has dry eye disease?
It is. Those are classic symptoms of someone who suffers from dry eye, although the symptoms can be variable. It's kind of a spectrum as far as the severity. Some patients really have severe pain. Other patients have more vague, kind of undistinct symptoms. Some patients have blurry vision. So it's really dependent on each patient. I tell other docs who consult with me about treating dry eye, I tell them if you've seen one dry eye patient, you've seen one dry eye patient. Everyone's different. So you have to really look at each particular patient and try to figure out what the underlying cause is for that patient, so you're able to give an appropriate treatment plan.
And I'm glad you brought that up, because we really should talk about what the risk factors are. And first of all, the bane of my existence, is this more common in women than men?
I guess the answer to that would be yes. The majority of patients in my practice are usually women between about 40 and 70. Classically, dry eye does tend to be more prevalent in women. So yes, the answer to that question would be.
And what about menopause? Is menopause a risk factor?
Absolutely, yeah. Menopause is definitely a contributor to patients who suffer from dry eye. So that's kind of another classic hallmark of menopause.
And what about all the things we put in our eyes? So contact lenses, makeup, false eyelashes, all those kinds of LASIK surgery.
Yeah. False eyelashes are definitely a trigger for me. Those are not my favorite things that the patients do. But the things that really, the three things that I commonly see in my practice, and this should be for basically anybody who treats dry eye, the three main offenders would be some sort of systemic inflammatory or autoimmune disease, especially things like Sjogren's, lupus, Hashimoto's, thyroid. Those are all classic patients who have dry eye. Patients who had previous ocular surgery. LASIK is almost the majority of my patients have had some type of either previous LASIK or PRK or RK, but even patients who've had cataract surgery and blepharoplasty as well, lid surgery, either cosmetic or functional keratosis, because you can go in there and damage the glands. I'll tell you one thing that really isn't thought of as being something that can be a factor is permanent eyeliner. People do that, sometimes who have dry eye, because they figure, well, I'm not going to be putting eye makeup on. Let me go ahead and do permanent eyeliner, because that'll be one less thing I have to worry about, and it won't bother my dry eye. But if you think about what you're doing there with that needle, you're actually puncturing through the meibomian glands to produce the tears. So you have a patient who comes in who's had, I can see them from the exam chair before I even put the microscope on them. You can see the permanent eyeliner. They've had LASIK done. They have autoimmune condition. They're going to be pretty severe as far as their symptoms go.
So obviously, Debbie's shared with us her story, which I really appreciate, Debbie. And I know you had a really long haul. But Dr. Austin, do you have any tips for people to get diagnosed sooner or much more directly than this long journey and complicated treatment course that Debbie had?
Right. I mean, just like Debbie was saying, there's definitely a psychological component to it. So sometimes that's, as she said, the first doctor who just gave her over-the-counter drops and I think warm compresses. Oftentimes the complaints are kind of dismissed or just sort of brushed under the rug. Hey, you have dry eye, just deal with it, take some eye drops. So I think that patients have to be their own advocate in terms of making sure that they're seeing a doctor who really is someone who is going to help them, who has the both diagnostic and treatment capabilities to treat the condition appropriately. And if they don't get the answer they want, or they're not getting the results that they want, feel free to go ahead and seek out another provider to go ahead and possibly get another opinion in terms of what can be done to help, because there's so many things that can be done these days to help with patients with dry eye.
Well, and there's so many products over the counter. Is this the kind of situation where people could just self-medicate with artificial tears or other eye drops before even seeing an optometrist or an ophthalmologist?
Yeah, good question. I mean, you go to I go to the drugstore there, and there's a whole aisle of eye drops there, and which one do you pick? There's so many different choices there. Kind of like if you have a headache and you're taking some type of pain reliever for that, if the headache's not going to go away, probably a good idea to look into that a little bit more. So artificial tears, think of those as more like Band-Aids as opposed to anything that's going to actually treat the underlying cause there. So they may give you some temporary relief, but those really aren't going to be the silver bullet in terms of getting to the cause.
Right. And I don't want everybody to think that everybody has to go through a long, complicated process. And of course, I know I was not the only one who heard you say surgery and plugs, Debbie, and got, felt the pain that and the emotional distress that you must have gone through. Obviously, Dr. Austin, most patients with dry eye do not wind up having surgery.
Correct. It's a spectrum. The severity varies from patients who it's a minor nuisance to patients who, literally get to the point where they're so depressed they can't function, they can't do their day-to-day activities. So most patients fall somewhere in between those two poles.
And Debbie, speaking of depression and other challenges, what specific challenges did you face? You mentioned that you had difficulty doing anything with your eyes, and most of us do a lot of things and rely on our eyes for a lot of things. So what specific challenges did you face?
Right. I am a busy person. I do lots of things. And it was really horrible to be stopped by my eyes. I'm an English teacher, lots of time on the computer. That was really hard to deal with. But I also didn't feel up for doing things like vacations or going out to walk on the beach or spending time with family and friends, because I didn't know how my eyes were going to react, going into restaurants, not knowing if that was going to be a hostile environment or not. And I got good advice from my provider at the time. Just try these things, do them, see what you can do. You'd be surprised. Don't stop living. And, so I learned how to take a plane trip, what to do with my eyes so that I could do that. I learned how to go into a hotel and still do my warm compresses. But it was a process. I'm in a really different place than I was at the beginning of my journey when things were so difficult. I still have the same challenges. I will always have dry eye disease, but I've learned through my providers, from Dr. Austin, from others that I've been so fortunate to have, my angels, my eye doctors, who have taught me that I can do everything. I just have to figure out how to take study breaks on the computer, or, to make sure that I'm blinking properly, that I'm doing my eye hygiene, and going in periodically for in-office visits to keep up with my eyes. And I do more than most people, but I have challenges. I also learned that life doesn't have to be perfect to be good. Everybody has challenges. And so when I work with people who have dry eye, I want to help them see that life isn't over. It's just another challenge that we have.
And hindsight is 20/20 vision.
Right.
Dr. Austin, you mentioned briefly about one of the major causes being autoimmune diseases, which of course are much more common in women. As an optometrist, when you see a patient with dry eye come in, what are some of the things, the clues? Obviously, most patients don't have an autoimmune disease.
Mm-hmm.
But what are some of the clues that might make you think that somebody needs to be tested for an autoimmune disease because of this?
Sure. Usually patients are not getting better if we're doing treatments, be they pharmaceutical, be they in-office treatments, and we're just not getting the results we want there. We want to look into if there's any sort of systemic component. So if that's the case, we'll usually send them out to have lab testing done to see if there's any sort of systemic component that can be contributory to that. Then we can coordinate with other medical professionals, be they rheumatologists or other docs who can help out with the underlying cause if that's part of what's going on there.
And we talked about a lot of risk factors for this, but one of the common things we didn't talk about are what are some of the common medications, whether they're over-the-counter medications or prescription medications that can either cause, contribute to, or exacerbate dry eye disease?
Sure. So if you look at basically any medication, if you really take that little tiny little fold out thing and look at what some of the side effects are, almost all of them have ocular contraindications to it, or complications, I should say. Some of the worst offenders are usually a lot of the drugs patients take for depression. Those are notorious for causing dryness with the eyes. Antihistamines, over-the-counter or prescription as well, can cause issues as far as the eyes being dry. Those are some of the main offenders, but just about any medication, most of them do have some sort of issue in terms of affecting dryness with the eyes.
And Debbie, you've learned so much, as you mentioned, and you've adapted very well, and you've learned how to modify your environment and your behaviors and your activities to accommodate this. But if we look back on your journey, are there any things that you would have done differently with respect to managing your dry eye disease that you'd like to share with our audience for the benefit of helping other people?
Yes. One thing that I wish that I had done is stayed with a local doctor. I flew around the country to see different doctors, and really I needed to have a relationship with a doctor and know that it was going to take time to treat things. Also, I don't know how many times doctors told me, just change one thing at a time and give that thing a time to work. Let's see, what is helping. And, some of the people that I work with, they want to change everything at once, but we really got to see what works. Another thing that I think that I would like to talk about is patient education. I had to do a quick study in all these terms, that all my diagnoses, and so keeping up on what's going up in the dry eye world, and documenting what's happening with me is really important. And the last thing is realizing that less is more. Just because there's 100 different things you could do, you don't want to do all of those. Just figure out what works for you and do those things. Dr. Austin and I have gotten it down to just a couple of things that make a huge difference in my life. And I'm glad that I don't have to do all the other new things that are out. If they were better, I would try them, but I've got a routine, and that helps a lot.
So that is not only excellent advice, each one of those things for people with dry eye disease, but the advice you just gave is applicable to almost every condition in medicine that I can think of, and especially even lifestyle and behavioral changes that people need to make. So that's wonderful advice. Now, Dr. Austin, we talked about how dry eye is really a spectrum. And we also talked about how treatments are a spectrum. We mentioned over-the-counter eye drops, prescription eye drops, but just can you give us a range of what other treatment options are available in addition to eye drops?
Sure. Yeah, one of the nice things about the last couple of years is the development of so many other therapies aside from just eye drops that most patients know can be helpful. One medication that we use a lot in our practice is actually a nasal spray. I know it sounds kind of weird. Well, how would a nasal spray work to help with dry eye? But if the type of tears being produced aren't sticking to the eye as well, this will actually stimulate the nerve that produces the tears that will stick better, and that'll help with keeping the tears from evaporating and making patients more comfortable. That's one thing that works really well. There's quite a few in-office treatments that are available now for patients, intense pulse light, radio frequency, even things such as serum tears, which are made from patients' own blood, meibomian gland probing. I can go on all day, amniotic membranes. So I guess that the takeaway is that we're not limited just to eye drops anymore in terms of what can be done for patients. There's so many other options depending on each patient's presentation and what's the most appropriate for that particular patient.
And so the bottom line is see your optometrist or your ophthalmologist if you're having persistent problems.
Absolutely.
And Dr. Austin, as you can imagine, I've saved the most important question for last, the $1 million question. what can people do to prevent dry eye disease?
Sure. Dry eye is a chronic disease. As far as preventing it, there's no, again, sort of magic bullet as far as some sort of program or regimen. What you can do is definitely maintain a healthy lifestyle. A lot of patients have found that by reducing inflammation, diets that are low inflammatory diets can be helpful. Making sure that if you are having symptoms, make sure you see your dry eye specialist sooner rather than later to minimize the chances of things getting worse down the road. And really just as Debbie said, you be your own advocate. Just make sure that you are staying informed and coordinating with the healthcare providers that can help, because there's so many things that we can do in 2024 that weren't even available even 3 or 5 years ago, and it's changing so rapidly. The nice thing about being in this field, and the thing that's so exciting about it for me, is that almost every 6 months there's either something new in terms of a procedure or a medication that's been approved to help patients. So the thing that I hate hearing from patients, they'll come in and say, my last doctor told me that there's nothing else that can be done. And I almost always say, well, I'm sorry that he or she told you that, but I'm pretty sure that we'll be able to come up with something that should be helpful for you. So, don't give up as far as if you've been told that there's nothing that can be done. Be an advocate, and obviously healthy lifestyle choices, just like most other conditions, are going to be helpful as far as maintaining healthy eyes.
And don't wear permanent eyeliner.
Don't wear permanent eyeliner. Don't have permanent eyeliner done. Exactly.
Anyway, we could talk about this for hours. I've learned so much from both of you. I want to thank you both for being here and really for sharing this information about such an important topic. I know you both have very busy schedules. I know, Dr. Austin, you have to get to see patients today, but I really want to thank both of you for your time, your knowledge, and Debbie, of course, for sharing your experiences. I also want to thank Viatris Eye Care Division for making this episode possible. And for more information on this topic, our viewers can go to healthywomen.org. I want to thank everyone for joining us today and remind you, don't forget to tune in for the next episode of Women Talk.